Module 2. What is trauma? In this module, we'll consider the definition of trauma and look at some of the different types, characteristics and symptoms of trauma. Let's start by asking what we mean by trauma. It's a word we're all familiar with, but it can mean different things to different people. Please pause the video and take a minute to reflect on what you think of when you hear the word trauma. When you're ready, please continue. A formal definition of trauma might sound something like this. Trauma results from an event, a series of events, or a set of circumstances that is experienced by an individual as physically or emotionally harmful or threatening, and that has lasting adverse effects on the individual's functioning and physical, social, emotional, or spiritual well-being. Let's break this definition down by thinking about the 3 E's of trauma: events, experiences, and effects. Trauma happens as a result of events. Traumatic events can come in all shapes and sizes. They can happen to anyone, regardless of background or culture, from young to old. These events are experienced by an individual as harmful or threatening. The effect of this is a lasting impact on someone's health or well-being. This impact could be physical, social, emotional, spiritual, or any combination of these. A family, community, or even an entire culture can be subject to traumatic events or circumstances that has a lasting impact on the well-being of the group. There are many different types of events that can lead to trauma. You can see a few examples on screen now. Please pause the video and take a minute to think of a few more examples. When you're ready, please continue. It can be helpful to make a distinction between big T and little t traumas. Big T trauma stems from events which involve exposure to, or the threat of, death, serious injury, or sexual violence. For example, this could include serious assault or rape. These events could have been experienced directly by the individual themselves, or they could have experienced them indirectly by witnessing these events or hearing about them happening to others. Little t trauma is defined more widely as caused by any adverse life events that have had a significant impact on someone's health and well-being. Little t traumatic events are not life-threatening. Some examples are experiencing bullying or growing up with parents who abuse substances, but there are many, many others. Despite the name, little t traumatic events can be highly distressing and have a lasting and significant impact on us and how we perceive the world. One important distinction between big T and little t trauma is that big T trauma can lead to the development and diagnosis of post-traumatic stress disorder or PTSD. Even though little t trauma does not lead to PTSD, it can still have a significant effect on our well-being. We'll look at PTSD in more detail later in the module. We've seen there are lots of different kinds of events that can lead to trauma. Let's consider how the circumstances of these events can influence their impact. The impact of a traumatic event or events might depend on whether it is repeated rather than one-off events, prolonged rather than brief, expected to happen rather than happening out of the blue, perpetrated by another person, especially if this is someone familiar to us, occurs to someone as a child rather than an adult, and occurs deliberately rather than being accidental. Take a moment to think about why the circumstances of some traumatic events might cause them to have a greater impact than others. Click continue when you are ready. There are many reasons, but psychologically the anticipation of trauma plays a big part. Knowing that you are going to be hurt or harmed and feeling powerless to stop it can have a greater impact than an unexpected event that occurs without warning. Another example is when we experience traumatic events in our formative years. This can have a great impact as it can affect the development of our brain and how we understand our world. Consequently, trauma can make it difficult for us to be able to rely on our thoughts and feelings in order to negotiate our way through life's challenges. We'll cover this in more detail in the next module. We've seen that traumatic events come in all shapes and sizes. It's important to acknowledge that any type of traumatic event is, by its very nature, distressing. However, the extent of the trauma depends on the way in which an individual makes sense of these traumatic experiences. Trauma affects each person differently, depending on the personal meaning that they attribute to the traumatic events. The way we perceive our role in the trauma, and what we feel the trauma says about others, the wider world, and our future, will influence how the trauma affects us, mentally, emotionally, and even physically. While our minds store memories of the trauma, our bodies also have a subconscious response to the trauma, which can involuntarily be recalled under certain circumstances. There are several types of threat or other triggers that can stimulate our mind and bodies to recall past trauma. These include other people, our own mind, dwelling on the past or worries about the future, what-ifs, loud noises, and unfamiliar or crowded places. Trauma can be recalled through all of our senses. This could be through what we smell, taste, or hear, for example. In some cases, this could happen underneath our immediate conscious awareness, which can be very unsettling. So far, we've looked at the wider definition of trauma, but what does trauma mean in clinical terms? Earlier, we mentioned post-traumatic stress disorder, or PTSD. PTSD is a condition that can develop after exposure to extremely stressful and traumatizing events, the so-called big T traumas we discussed earlier. Symptoms of PTSD are wide-ranging, but they can include reliving the traumatic event, for example through flashbacks, unwanted memories, or nightmares. Heightened anxiety and feeling on edge, agitated or irritable, along with difficulty sleeping or concentrating. Deliberately avoiding people, places, or even objects that could trigger memories or thoughts of the traumatic events. And having a more negative view of ourselves, others, and the world around us, carrying feelings of shame or guilt, and blaming ourselves for what happened. But why do traumatic events lead to the symptoms of PTSD? The answer lies in the way our brains create and store memories. Let's explore this further. Our normal memories are formed by part of the brain called the hippocampus. The hippocampus acts as a librarian. It takes our memories, stamps them with a date and time, and files them so they can be retrieved at a later date. Another part of our brain, the amygdala, acts as a threat system, regulating our responses to danger. Under normal circumstances, the amygdala and the hippocampus work together in unison. At times of trauma, the threat system is overwhelmed and the amygdala takes over. The hippocampus can no longer function as normal. We still store the traumatic memories, but these are no longer neatly filed in place. Once the traumatic event has passed, our minds try to process these memories and file them away. This leads to flashbacks or nightmares as the memories spill out. Because these memories don't have a date and timestamp, they feel more immediate, as though they're happening all over again. We try to keep these memories pushed into place and avoid anything which can remind us of them, but we can't hold them in place forever. We saw earlier how traumatic events can impact individuals in different ways. Traumatic events that are prolonged, repeated, anticipated, or perpetrated by another person can lead to additional symptoms that are more debilitating and cause greater impairment than PTSD. We call the condition associated with these symptoms complex PTSD. Complex PTSD has the same core symptoms as PTSD, but in addition, those affected might hold a negative view of themselves marked by feelings of worthlessness, shame, guilt, or despair. They might have difficulty maintaining relationships or engaging with others. And they might have difficulty regulating their emotions, such as anger, or they might feel numb and disassociated from the world around them. We'll return to the cause of these symptoms later, when we look at the idea of attachment. In this section, we've looked at what trauma means in terms of events, experiences, and effects, different types of trauma and the distinction between big T and little t, how the impact of trauma is affected by the meaning we attribute to it, the symptoms of post-traumatic stress disorder, an explanation for these symptoms based on how we process memories, and finally we looked at the cause and symptoms of complex PTSD. In the next module, we'll look at the impact that trauma can have on us as individuals and the wider impact on society as a whole.